Welcome everyone to the Let's Work Together to Make Family Lives Easier, How to Coordinate Eligibility and Enrollment to Increase Equitable Access to Services. This webinar is part of a series of 4 webinars from SRI designed to support early childhood comprehensive systems. We thank you for joining us today to discuss coordinated eligibility and enrollment as a mechanism to increase equitable access to services. We hope that you will join us in May for a discussion on engaging the right partners to plan your ECIDS, and in June for a discussion on engaging families by supporting decision-making. We were excited as we reviewed the registration list for today because we know many of you as we worked with you over the last 3 years when we led the National PG B5 TA Center. At SRI, we remain committed to supporting your state early childhood work, and our team at SRI is excited to spend time with you today on coordinated eligibility enrollment. My name is Denise Mozzie, and I'll be your host today. Wei-Bing Chen is a leading expert in early childhood coordinated eligibility and enrollment and has supported numerous states in launching and refining their coordinated eligibility enrollment efforts, or CEE. She has presented on this topic in multiple national forums and recently published a brief on this topic. We'll be providing you a link to that brief in the chat and in the resources slide later in the presentation. Wei-Bing will be joined by Howard Morrison. Howard is a leading expert on use case driven data systems planning and has supported states in thinking about how to use data and data systems for their CEE efforts. He has extensive experience in interagency data integration and use, data governance, data sharing agreements, constituency engagement, and state systems. Together, Wei-Bing and Howard will present 3 critical action steps for planning implementation of targeted CEE strategies. We are targeting our comments today for those who are planning for CEE or are still early in the process of implementing CEE in their communities. We'll be leaning on examples from states and communities that have completed these steps and are moving into active implementation. If you are from such a place, I really encourage you to stick around and share your experiences and expertise with other states. Coordinated eligibility and enrollment can occur along a continuum of services and can provide a range of activities from simple to complex. Our goal today is to really hone in on the actionable steps that you can take now to support families to access early care and education programs with a particular emphasis on publicly funded programs. The CEE journey is not a short trip, but with proper planning and engagement with the interested parties, you can be successful in mapping your route to include tangible wins. With that, I'm going to turn it over to Wei-Bing.
Great, thank you so much, Denise. And thank you all for joining us today. So when we announced this webinar, we promised you 3 critical action steps for implementing CEE within a community. We're actually going to cut right to the chase and give those to you right away. And then we're going to spend the rest of the time really diving into each of these steps. So this is meant to represent a 3-step planning process that will move you from like the beginning stages of planning for CEE to actually implementing. Step 1 is develop a common understanding. This means that collectively within your community, you want to understand what CEE is and why to do it. You want to know what is possible for your community through CEE. Step 2 is agree on your direction. You want to reach consensus at the regional or at the local, state, or regional level, one of those levels of governance at least, on what your CEE goal is going to be. And then step 3 is you want to map your route. Together within your community, you want to lay out the roadmap for achieving this goal that you've chosen. I want to point out that each of these steps requires a whole team of people being on the same page with each other. And this is because at its core, CEE is a systems building strategy, and people from all across the system have to come together to do it. Okay, so now let's deconstruct each of these steps a little bit more. Step 1, develop a common understanding. This is really understanding what CEE is and why you should do it. And that means everyone in the room not this room that you're in right now, but your community's room needs to know the answers to these two questions. So we want to start with an activity, and I'm going to ask you to think about your own community. We're going to start with the why of CEE. So we're going to launch a poll. There's actually going to be multiple parts to this poll, but the response options are going to be the same for each statement. It's a series of statements. I want you to think about whether this describes your community or state, and choose either, yes, this is definitely an issue for us, kind of, we've made some progress, but we're not quite there yet, or no, we have this totally figured out, feel free to call us. So the first, oops, went the wrong way. So in my community, the first statement is, families are often unaware of which programs exist to serve young children and have to search multiple places to learn about them. So you should see a poll pop up and then choose either yes, kind of, or no. All right, let's see some responses. We'll give it another 10 seconds. Okay. Going to move to number 2. Families who need the services most may have the hardest time getting access to what they need. Does this describe your community? Yes, kind of, or no? Give it another 10 seconds or so. If you haven't already answered, please do. All right. Number 3, families have to submit multiple applications for programs or providers they're interested in, and they have to wait to hear where they can go. Another 10 seconds. Okay. Number 4, providers of similar services can feel like they are competing with each other for children and families. So another 10 seconds. All right. We have 2 more. And these last 2 are about use of public resources in the community. So use that frame of that lens when you're thinking about this. Programs or providers have to wade through a large number of applications to find families who are eligible and a good match for them. Another 5 seconds. All right, and the last one, thanks for sticking with us through this. Individual families may choose programs in a way that does not make for the most efficient use of public funds when looking across all families. This one's a little bit tricky, but we'll talk about that in a minute. All right, so we're gonna move on, and while you all have been filling those out, my host Denise has been populating the results. So we wanted to share those all at the same time. So this is a summary of the total of percent of you who said either yes or kind of to each one of the items. And you can see that the percentages are really high. So I think you can probably tell the message we're trying to give here is that the early childhood system can be really fragmented in most communities, that it's a very common problem, and that this results in challenges for families when they're looking to, find services for their children. It results in challenges for providers when they're trying to figure out which children qualify for their services and who to enroll. It also results in less than efficient use of public resources in a number of ways. So there's a few caveats I want to mention that in this context, we're really talking about publicly funded programs, but this can also apply to privately funded or self-pay programs. And we're talking about we're talking about providers in the context of programs where you have multiple providers in various settings that may be providing very similar services. So that can really set folks up to feel like they're competing with each other, and I think a really common example is when you have state preschool programs as well as Head Start, for instance, and when state preschool comes into a community, sometimes you hear providers from Head Start or childcare providers saying, they're stealing our children, or those kinds of comments. But it doesn't have to be that way. Because when you work together, you can really work out ways to serve all of the families collectively. Okay. So, given all of these challenges that we've just described, what can community and state leaders do to improve this situation? And you all are here for a webinar on CEE, so you can guess that that's a solution that we're going to propose. And we want to see, first of all, how you all are defining or conceptualizing CEE. And so we're going to launch a Mentimeter poll, do another quick activity. And Denise, it would be great if you could drop that link in the chat for everybody. And all you have to do is click on the link. It may ask you to put in a voting code, but when I tried it earlier, it just popped up on the screen for me. So we'd like you to enter a word or phrase describing what doing CEE means for you or your community. What does CEE mean for you? And you can actually enter more than one if you have several thoughts you want to share. And if this isn't working for anyone, you can feel free to put something in the chat and we'll see if we can help you. But I'm starting to see results pop up. So some of you are getting into it. We'll just give you another 15 seconds to add some words or phrases. Okay. So feel free to keep adding, but I'm actually going to share what I see. I can do my technology right here. All right, so hopefully you all are seeing the word cloud on the presentation screen also. And you can see that Access, this is a hard word cloud because a lot of people have put in phrases, but access is showing up as one of the more common things that's being entered, and so is collaboration. But you can take a moment to read what else folks are thinking. Single point of entry, simplification, ease, removing barriers, better service, satisfaction, creating one application. So we have some thoughts on, the outcomes of CEE, what we're hoping to achieve in a community by doing CEE. We also have some thoughts on like how you would do that, right? So a single point of entry, the one application. Okay, that's great. So I think I wanted to do this as an activity to kind of get people thinking about what CEE really is. And my working definition that I often use is that CEE fits under this broader umbrella of systems coordination efforts. Okay, so it's one of many strategies that is under systems coordination. Other efforts can include aligning like program standards or program eligibility. It can include coordinating funding, so blending and braiding funding, or sharing, linking, and integrating data. So CEE is just one of the things that you can do in your community to increase coordination. And then the name coordinated eligibility and enrollment implies that you're coordinating eligibility determination and enrollment into programs. But there's actually a range of program enrollment processes that can be coordinated and a spectrum of how tightly coordinated those processes can be. So we're going to talk a little bit more about that. And I'm going to move the Mentimeter so that we can go back to the slides. If I can close this. All right. Okay. And actually, I want one more caveat that I want to make is that when we're talking about CE, we're talking about coordinating enrollment processes, so program enrollment processes, and not coordinating actual service delivery. And we know that there are examples in communities where enrollment processes are not necessarily coordinated, but service delivery is actually coordinated through either co-locating programs or blending classrooms and other strategies. But today we're focusing on coordinating the enrollment processes. And so let's go back for a moment to why we want to do this. And you all put a lot of this already in the Mentimeter, the word cloud. But let me paint you a picture of an idealized community where eligibility and enrollment into services is fully coordinated. So in this community, families have easier and more equitable access to the services that are the most appropriate for them. I saw that a lot in the word cloud. And just to unpack this a little bit, some of you put single point of entry, that there's one place for families to go, be it a website or a phone number for them to call, a single application to fill out, and one eligibility determination process to undergo. This I think vastly simplifies what is a typical process for a family where they're applying multiple places, they're uploading their verification documents in multiple places or sending them in. And when you reduce the barriers to entry to programs, and families are all using the same clear and transparent process for applying and enrolling in then access is more equitable. In sectors like early care and education, where you have multiple service providers, that as we have been discussing, when you have a coordinated system and you're encouraging providers to collaborate with each other as the main strategy for maintaining full enrollment, rather than feeling like they're stealing each other's kids, this is also a huge benefit, of coordinating eligibility and enrollment. using a joint application and selection procedures means that providers end up having equal access to what is in practice a really typically large pool of families that are looking for services. And fully coordinating enrollment also allows for better use of public resources, as we already hinted at before, because it reduces the redundancy in the application and enrollment process for both families and providers. And in some communities that choose to match families with a single provider using a best fit process, public dollars are used even more efficiently, because through this matching process, the overall needs of the community is actually balanced with the needs of individual families. So hopefully you're thinking, wow, CEE sounds great. I think many of you have come in knowing a little bit about it and knowing, why you should do it. But how exactly do we do it? What exactly do we do is what we're going to talk about next. So I said earlier that there's a range of program enrollment processes that can be coordinated and a spectrum of how tightly coordinated these processes can be. So regarding the range of program enrollment processes, these can include outreach and recruitment, application or intake, eligibility determination, selection or matching, and enrollment. These processes do tend to move sequentially from left to right, although that's not always a hard and fast rule. And those of you who work within programs or administer them know that these processes will vary depending on what types of programs you're talking about and what your current early childhood system looks like. And there may be other factors that aren't represented here as well. For example, referral may be a key part of some systems, and some systems have dedicated staff members who are there to help families navigate these processes. But in general, coordinating enrollment processes, some communities may choose to tackle, for instance, only the outreach and recruitment piece, because it's easier, it requires less commitment, and is a smart place to start while you're still building relationships. While others may aim to create a common application for a certain set of programs, and still others may want to fully coordinate enrollment into programs, meaning selection of a program must occur for each family, and they have to be, and some may even choose to match with a single best fit provider. Okay, so regarding the spectrum of how tightly coordinated enrollment processes can be, I like to use this framework that's from the Tamarack Institute, which is they're a Canadian organization that does a lot of work around community change and collective impact. And I encourage you to try to find this resource. It's embedded in the brief that I wrote because they go into a lot of depth about this spectrum as well as all of the dimensions, so what kind of outcomes you can expect when you collaborate rather than compete, what kind of governance structures you need in order to collaborate rather than compete, et cetera, et cetera. But today we're going to look at just the simple version. And what the goal of CEE really is to move your community, your programs, and the providers within the programs to move them from competing to the cooperating, coordinating, and collaborating end of the spectrum, maybe even integrating. So the way that I conceptualize this is that the range of program enrollment processes and that collaboration spectrum actually run parallel with each other. And the closer you move towards fully coordinated enrollment, the closer you need to move towards collaboration or integration, because coordinating complex processes requires working together really tightly. So the bottom line is that systems coordination increases when programs move from having separate processes to having joint processes for application, eligibility, and enrollment. You might be thinking, well, this is all really hard to do. And I agree with you. It takes a substantial initial investment to do this kind of systems building work. And there may be resistance to changing what are longstanding programmatic practices. for the sake of a greater good that is yet unproven. But once you do it and it's working well, it can really save time and resources for the families as well as for the providers. And as a professional, you can feel better knowing that families are really getting what they need. So I'm going to pause here. It feels like I did a lot of talking and I haven't been checking our chat to see if there are any questions.
So Wei-Bing, there is a question that was posted. How can CEE ensure equity for family child care providers as well as families?
How can CEE ensure equity for family child care providers as well as families? So I'm assuming the asker is asking about family child care specifically, maybe a system of early care and education where you have, school-based programs and you have center-based, like community-based programs that are in centers. And I think that maybe what the questioner is getting at is that in your system, like these different providers have different levels of presence and power, and that family child care is often left out of the loop when you're trying to kind of bring interest holders in a community together. That we often think about like centers, for instance. And so I would say that this goes back to that community building piece of things, where if your community has interest in CEE and you've decided, okay, we're going to try to coordinate across early learning or early care and education programs, you want to bring everyone to the table to the best of your ability, right? So it starts with inviting those folks. And when you are talking about like how we want to do this as a community, you want to have their voices present, and you want to create systems that work for those family child care providers as well. And I think that's a really big oversimplification. But for me, it goes back to everyone who's part of your system has to be there at the table early on in the planning process. And you want to build the buy-in from everyone, and you also want to hear from them how to make the system work for them. I see a couple of comments. Often it is easier to place children in public preschool or Head Start than family child care. Yep. And family child care does not have the resources to meet the criteria often required for CEE programs. So I'm wondering if that is getting at that sometimes we have when we have systems, like especially when there's higher levels of governance, like for instance, if the state is involved and they're trying to promote high quality care and they're tying it back to quality rating and improvement system indicators, like we all know it's really difficult for family child care providers. There's much bigger barrier to entry to be rated in some of those systems, and that right there is an inequity. And that then when you're bringing community together to plan around CEE, those providers might be the ones getting left out. Yeah, that I think you all are speaking towards the complexity of this work, and that's why I think some of what we're really raising is that it takes a lot of community building and consensus building. That there's a lot that goes into the planning process before you can even get to the part where you're trying to implement anything.
So Wei-Bing, we have just a comment in the chat in terms of that often some of the planning to bring people together happens during the business day when centers can send administrators, but family child care providers cannot get away. And then a question more specifically, if you have examples of state, county, and municipal coordination, and are the current systems that are doing this, doing it well? Doing this well, yes. Actually, we're going to get to that in a minute. And we're hoping that, when we were doing the poll, there were some people responding no, so
says to me that I know there are communities out there doing this that we don't know much about. And if you're from those places, I encourage you to add to the chat, but we absolutely are going to share some examples of local communities as well as states where they're doing statewide implementation of CEE locally. So hopefully that'll give you some ideas of where to look for models. Okay, so in the interest of time, I'm going to move on. We're going to have another touch point for questions down the road, and feel free to keep adding to the chat as we're talking. Okay, so oops, sorry, Howard. I'm going to turn it over to my colleague Howard to pick us up at step 2.
Right. Thanks, Wei Bing. And I think this will also get at some of the questions around the family child care involvement and the organizations and entities that might support family child care. So just wanted to caveat that. So now that you've developed an understanding of what CE is and what can be achieved, we're going to now talk about the second action step. So here in step 2, the focus is to agree on your direction. So as a local, regional, and/or state level community, and as a core team, you really want to reach consensus on a CE goal before moving forward. So some of the key considerations and key questions in choosing a CE goal, these are all factors that are interrelated, and not one is a linear process moving from one factor to another. So you must first determine where on the collaboration spectrum you want to be and with which program enrollment processes you want to coordinate. Do you want to conduct joint outreach and recruitment, create a common application, or fully coordinate enrollment into a certain set of programs or among certain groups of providers? So this is what we just talked about a little bit. And you can either start really small and then get more ambitious as you gain more buy-in with your constituents and partners and have sustained resources that might be available to your state, your community, your localities. So first, communities must also choose which service sectors or which programs they want to coordinate across and the scope of that coordination. So it's most common that we see communities that work within single service sector. So this could be coordinating state pre-K, Head Start, childcare, potentially family childcare, as was mentioned earlier, that fall within the early care and educator sector, or coordinating WIC, SNAP, or TANF. These fall within the benefit sector. But some take on coordinating across multiple sectors. So for example, early care and education with the benefits programs, or with health and mental health programs. So something to keep in mind is that whichever programs you're working together with and working together on, and for anything beyond joint recruitment, you need to case management this work together. So this means CEE efforts require some level of data sharing or joint data management and data capacity within the organization. And so this has kind of a broad range. It can range from simple, Microsoft Excel worksheets and ensuring that data is private and secure, to using an integrated data system across agencies. So communities must also choose what level of governance they want to implement. And this could be at a local, a regional, and/or state level. And I say and/or because these are not all mutually exclusive when we're talking about coordinated eligibility and enrollment. So when the scope of coordination is limited to services such as benefits programs where there is no local provider and enrollment requires only eligibility determination, then coordination can potentially occur at the state level with little to no local involvement. However, when provider selection or matching of families to providers is needed, coordination typically needs to occur at the local or regional level. So however, state, territory, and program administrators can still be highly involved by providing guidance, oversight, and supportive infrastructure across these sectors. It's worth noting that CEE has the farthest reaching effects when implemented at both the state and local levels, with aligned decision-making and flow of data between these two levels. So now we want to bring some of this to life by sharing some examples of communities and states that we know are implementing CEE. These are some examples that we're aware of, but by no means are these the only places that are doing CEE. So we encourage you and those that are on this call to share examples in the chat that you may know of. We'd love to hear more and share some of the great work you're doing. But we want to start with the local level and then move up to the state level. So for an example of local implementation, Roanoke Valley, which is in Virginia, has Smart to Start. So this is an online common application that has a wide range of early care and education programs. This actually includes a private pay program, which is very unusual and different from many other CEE programs that we've seen. This program specifically works for children ages 0 to 5.
So this is a screen capture of the Smart to Start webpage, and we just wanted to I put the web address because it is in the bottom right corner, and we're also going to have these links on the resources page. But we just wanted to show you kind of the scope of what some of these communities are doing by looking at their websites. So here you can see, so like Howard said, this is a region in Virginia, and you can see that their coverage area is quite wide. It includes a number of cities as well as counties in Southwest Virginia, and that they are basically connecting the school systems, nonprofits, faith-based communities, and private childcare providers in these areas that serve children ages birth to 5. So families can come here if they live in these areas, and they can apply online. There's an online application that you just enter your information directly online. You can also download your application and I'm assuming send it in. But all the families who are looking for early care and education programs for kids 0 to 5 within the community come here to apply. And I see an example or a question saying, does this example also include application for CCDF subsidy? I'm not sure about this. I do think that I've seen examples where they do and examples where they don't, because I know it's really complex trying to integrate the subsidy piece of things. The folks at Smart to Start, if you go to their website, they actually have a phone number and an email address to where you can reach out to them. And they are very open to sharing their experience. And you could probably email them and ask this question. I actually had a conversation with the folks there, and that's how I know that they actually do include providers who don't even serve kids who have public funding. So these are completely private pay providers. And I think that's very unusual, because most of the time when you're talking about developing CEE for a system, it's for publicly funded programs. Okay. Oh, somebody is saying, I signed my children up for childcare using Smart Beginnings, public pre-K and private childcare. That is actually my son's daycare in the photo. Wow. Well, that's excellent. I'm hoping that you can share a little bit more about it, or folks can reach out. Like I said, to the folks to the Smart to Start, it's actually, I think, run through United Way of Roanoke Valley. So I'm trying to search for the word, like the people who host their platform, to get more information. And oh, okay. And yes, she's on the United Way Family Council. So thanks for joining me. example always strikes me as one of the best like regional examples of CEE that I know about. Okay, so now I'm going to pass it. Sorry, go back to Howard.
Great, thanks, Wei Bing. So now let's talk a little bit about where the state is involved. And so we know Virginia, Michigan are both state agencies that are supporting local communities in implementation through guidance and technical assistance. But CE is not required statewide. And in fact, their newly established early childhood hub model, Ready Regions, which is in Virginia, hopes Roanoke Valley can be a model for this and for others. And so similarly, Michigan provides extensive technical assistance and resources for local communities interested in CEE, but implementation is not required.
So this is a screen capture of Michigan's PDG V5 website. And it's just to show you that they've invested fairly extensively in creating resources for their local communities, but the entire right-hand column are CEE resources. There's webinar recordings, and they also facilitated a community of practice for their local communities that were interested in learning about how to implement CEE.
All right, so where is local CEE being implemented statewide? Louisiana has been doing this work for the past decade. They were actually the first state to fully coordinate enrollment into publicly funded early care and education programs statewide. So this is done at the parish, or some of us that are more familiar with county as the terminology. And the specifics of implementation and sophistication of systems varies, but all follow a set of parameters that is set by the state agency. So Enroll NOLA is a program for public programs and is the system for New Orleans. It's one of the more sophisticated systems and is, as it's one of the most populated areas in the state. So this portal has an online common application with embedded verification for publicly funded early care and education programs. And it actually matches families with providers using a single best offer option. So their website includes extensive information and a provider location tool that Wei Bing will talk about on the next slide.
So this is a screen capture from Enroll NOLA. So there's a couple of things I wanted to point out here, which is New Orleans, their website actually encompasses K-12 as well. So they have what appears to be a really integrated system. You can see across the top that you go to one place to enroll your children in K-12 schools, as well as publicly funded birth to 4-year programs. And so this is the tab for birth to 4 years. And, you know, you can see they've got a lot of information around like who's eligible and what do you do to apply. And this is a fully full service portal where you have to create an account, but then, you know, you can directly apply for services through the website, and it actually prompts you to check eligibility criteria there, and you can upload your eligibility verification documents straight in as well. And then a key piece of it is that you, as a parent, you rank order your choices for where you want your child to attend. And I know they do this for the K-12 part of the system as well as for early childhood, the early childhood programs. So you put your preferences in there, and then they use the system. I actually don't know a lot about the back end of how this happens, but they use their system to take into consideration program priorities, parent preferences, eligibility criteria to then match families with a particular program and offer that as this is where you get to go. And I think this is an example of a community that is trying to balance, the needs of the community at large and trying to use their public resources in the most efficient way with the preferences of individual families. And I know, this is an issue that causes tension in a lot of communities, and each community they will decide how they want to handle this. But I think Enroll NOLA is a really great example of kind of a really well put together publicly facing portal that is the front end of a really complex system that they have for fully coordinated enrollment.
Before we leave this example, Wei-Bing, there's a question in the posted, are IDEA programs, so early intervention or early childhood special education, part of the NOLA CE example?
So there's other folks who I think are more expert in this than I am. I'm not sure the answer to that. My guess is that it is, because I have seen, all of the New Orleans parishes have to do this, right? All of the Louisiana parishes have to do this. New Orleans just has the most sophisticated online system. I have seen a lot of websites for other parishes, and I've seen kind of PDF documents of their applications. So you can actually pull up a map of Louisiana and look up all their parish names, and you can just Google them. And many of them will bring you to a website that includes a common application for the programs within their geographic region. And what I do see on there is there are questions about whether your child has qualified for IDEA services, and there are questions about whether you have concerns about your child's development. So I'm not sure exactly how they integrate the IDEA piece of it in, because I know, a lot of the times you qualify, you have to go through you have to undergo evaluation, and then when you're found eligible for IDEA services, then you have to find the setting, especially for kids that are in early intervention, that you would receive these services through, right? So I'm not sure the details of how that all works out in the state, but I do think they have considered the integration of IDEA into their overall CE system. Hopefully that answers your question enough. And I've done a lot of just digging around on the internet for information about how this is implemented in various places in Louisiana. And so if you're interested, you could do some looking yourself. Okay. We're going to move on.
Thanks, Wei-Bing. So 3 years ago, in a phased rollout, Oregon started requiring CE as a part of their state pre-K expansion. Colorado is currently developing plans for CE, which is tied to the universal pre-K implementation, and are working with a vendor on a statewide UPK application that they plan to have grown into a common application that's available to all publicly funded early care and education programs. So what about the state and those not local implementation? So there are some state web portals are now a popular strategy, and South Carolina has their first 5 SC, which is an early childhood portal with information for over 60 programs that are in 5 service sectors, and they are managed by 11 state agencies, which is a really large number. This features an eligibility screener for 44 of those programs. It has a leads collection function where providers can contact families who have used the screener if they give permission. And so they are currently working on a common application for a subset of programs, which has just been launched. So lots of progress being made at South Carolina First 5 for their state level implementation. And Wei-Bing will share the details about that website on the next slide.
Okay, so this is a screen capture of the First 5 South Carolina site. And I think what is pretty amazing about this site is that it really is cross-sector. You can see across the top, like Howard said, there's 60 some programs that where there you can find information about those programs as part of this. So there's early care and education, health and safety, special needs and early intervention, food and nutrition, and parenting and family support. And you can also see, so within the 60 some programs that you can check your eligibility for 40 of those. And as Howard mentioned, you know, the state, I think what's really cool about when you have a web portal and there is a back-end data system that is keeping the data somewhere, is that when families go in and use the eligibility checker, and of course they're very cognizant about privacy and data sharing and across the state agencies, but also the privacy of the families who are going in and putting their information in there. When permission is given, I think the information is channeled into a system, a data system. And I know that they're working with the folks at the state who are developing their early childhood integrated data system to make sure that these two efforts are being developed together to leverage the two things, you know, the data system and the portal, to be the most effective for the families, but also for the folks on the back end, the service providers and the folks at the state who are administering the programs. Okay. And I think, you know, you can see it says you can now apply online. I think this is very new. They were aiming to launch the common application early in 2023, and this may have just happened.
So some other state level implementation includes Minnesota, and they have Minnesota benefits, and Michigan, which has Michigan benefits, and they have fully developed benefits portals with common applications, and in some cases, common eligibility determination.
Right. Yeah, in Michigan, and I think they actually call it My Benefits.
Oh.
They have a lot of my this, my that with the MI. Yeah. Okay.
All right. So once you've done the hard work as a community of understanding what CEE is, why you should do it, and have chosen a goal, action 3, which is step 3, is map your route. So this should be easy, right? You just laid out the steps you need to take to achieve your goal, one at a time. It's also important to develop ways to track progress. So, but in all seriousness, you will need to have done a huge amount of work and community consensus building just to reach this point. So as you get into the details of planning implementation, you will need to continue to gain buy-in from your leaders within and across agencies or organizations, and from the community. So there are a few key facilitators and barriers when working on CEE. So in fact, relationship building is a key facilitator of this work. On the flip side, this can also become a big barrier if it doesn't happen well. These are two sides of the same coin. So coordinating enrollment processes takes problem solving, compromise, and as we mentioned before, willingness to change longstanding programmatic practices for a greater good. Teams or committees need to work together to foster a sense of partnership and treat these relationships like human infrastructure that requires time and investment. So 2 other main facilitators and barriers to CEE are funding and having a champion. So investing in CEE is investing in more coordinated early childhood care and education systems, but finding the extra funding to build the system beyond implementing programs, which can be difficult. So to make progress, steady funding is needed to build the system beyond, and then steady funding to pay for both staff time, which is needed to meet and develop processes, and for any data infrastructure or data sharing or data management. So one or more champions are really, really needed to make CE work and make their cause work and lead the work through challenges is another key to success. So ideally, these individuals will be in a position of leadership where they are empowered to make consequential decisions and are able to reach out across programs and or agencies to build strong relationships with other leaders. So we would like to think that these facilitators and barriers are common to any systems building initiatives or systems building work within your communities or agencies. And CE is just one of those strategies for systems building. So we have one poll question here. So we'll do this quickly. So just please let us know, where is your community or state in planning for CEE, and choose all that apply. We'd like to do this, but it's feeling a little too ambitious for us right now. We have a committed core group convened for planning. We are well into planning, but are not yet ready to implement. We have goals chosen, a roadmap laid out, and the community is ready to start driving. At about 40% here, we're up to 46. Another 30 seconds, maybe. Okay, I say let's close and publish those polls. Okay, so we've got about 60% a little ambitious, 40% have a core committed group, 13% well into planning, and about 13% we have goals chosen and a roadmap laid out. So great kind of span across those 4 topic areas. So in essence of time, I think we'll go right to the key takeaways, and I'll turn this over to Wei Bing.
Okay, I know we are really glad that folks have been engaged and sharing their questions and experiences in the chat. But we've got just 2 more things to get through. So we wanted to end by bringing it back to just the key points that we're hoping, if you remember anything from this today, it's what's on this slide. That CEE is a systems building strategy that requires widespread community buy-in to plan for and to implement. It takes an initial investment in relationship building, time and resources, but if you do that, it can lead to easier, more equitable access to services for families. It can lead to collaboration rather than competition as the strategy for achieving full enrollment for providers and more efficient use of public resources for the community. It also takes expertise on the what, why, and how in CEE. And this is what we've tried to give to you today. So you can take it back to your communities and demonstrate the benefits so that you can get that buy-in. But also know that you are not alone. So this is hard and complex work. There have been a lot of questions raised about the nuances of like how you fit in the funds from various different types of funding streams, the issue of equity. So if you're interested in more assistance, please know that you can always reach out to us, either at the earlylearning@sri.com address, to us as individuals, or by connecting with us on LinkedIn. And these are the resources that I'm hoping y'all, if you're interested, will take a closer look at. We have the websites that were featured in this presentation. There's also a link to 2 written documents that were developed. This one, the CE brief, very recently. It actually lives on the federal PDG B5TA website. And the last link is to a podcast episode where the folks from South Carolina that developed the First 5 South Carolina website, go into real depth about what their goals were and what their process was in putting that website together and maintaining it. Okay, and now Denise, you've got 30 seconds.
All right. Thank you so much, Wei-Bing and Howard, for sharing all of this great information. We've posted a closing poll. I'm hoping that you'll provide some feedback to us at SRI about how well we did today in terms of the quality of the information provided in the webinar. We take your feedback really seriously as we endeavor to engage in continuous quality improvement as well. So we thank you for completing that. And also just want to remind you on the next slide, Wei-Bing, that this is just the second in a series of 4 webinars. And we hope to see you again on May 4th for the Don't Do It Alone, Engage the Right Partners to Plan for the ECIDS webinar. Again, thank you for your time today, and we look forward to seeing you on May 4th.